If you're thinking about exploring plant medicines or other psychedelics intentionally, therapeutically, this video is for you. And I'm going to share the most important tip last. So stick around to the end. This is Eddie with a Mindful Emergence, where Margaret and I offer simple steps, mindfulness, movement, and breathing practices for spiritual transformation. So, of course, more and more now people are starting to explore plant medicines and other psychedelics intentionally. And I've got some tips for you that I hope are helpful for you to decide who to work with. There are different people who call themselves sitters, guides, space holders, and it's different for different people. And what kind of criteria might you use in selecting someone to work with? Because doing it on your own, especially for the first time, is probably not the best idea. Okay, so the first criteria is pick someone that you feel a connection with. And having said that, maybe not a family member or friend. Okay, think about this. Is there any kind of emotional entanglement or baggage that might sort of clutter up or contaminate the experience? Sometimes it's better to pick somebody that you're not as close to. Think about that. Another one is, have they had any personal experience with these medicines, as we refer to them? Or are they encouraging you to work with them in a terrain that they have no personal experience with? Not a good idea, okay? And then that brings us to the question is, what kind of experience have they had holding space or sitting for others? Find out how many people have they sat with. And what kind of training do they have? Have they taken courses? How much do they know about this process? And do they collaborate with others to share information and learn and grow? Do they have any connection or resources with people outside their scope of practice? So if you need additional support, maybe addressing medical questions, they don't have to be medically trained, but it would be great if they knew somebody that they could talk to who is, to address questions that might come up about medication or any kind of medical issues that might exist. Could be helpful in many cases. Also, let's talk about, have they had experience? Are they trained at all as a counselor or therapist? Not essential, but there can be a lot of emotional stuff that can come up. It can be a bumpy ride. Do they have any experience supporting people through that process with any kind of training in that way? Also, let's talk about the setting, the environment. What's it like? They don't necessarily have to have a space devoted for space holding, but whatever they're offering, is it clean? Is it comfortable? Is it attractive? Is it safe? Do they have access to outdoors as well as indoors? It's nice to be able to have those two options available to you. So let's talk about, first of all, screening. Do they do that? Do they do an intake process where they ask a number of questions about what your intention is, what you hope to get out of it? Intention is really an essential part of this. So it's important that that be explored, as well as anything else that should be addressed before you do this, which is preparation. So do they offer that as part of their preparation? And what else do they offer? Do they ask questions about how to support you? Do they offer practices such as breathing, mindfulness, movement practice that can help you navigate the experience and work with physical issues that can come up? Not unusual to have some discomfort. How do you navigate that? Are they going to help you prepare for that? And then it comes to the question of integration. So not only do you want to ask, how many preparation sessions are you offering and what specifically does that include? But what about integration? If there's no integration, then you've just had an experience. Integration is the most important part of this. How are they going to help you unpack this experience and take the value of this that's been created and really take advantage of these new neural pathways that have been opened up? How can you take the content of that experience and apply it to your life as you're moving forward, so you're not in 3 or 4 months just going, everything's back to normal? And I have to tell you, it boggles my mind how many people are doing various plant medicines and psychedelics in various settings. There's no integration. I mean, that's really, really important. Find out what they're doing and how they're going about it. So another thing that some people like is instead of having just one person sitting for you, having two. And there are a lot of points of view that having a male and a female can be really helpful in terms of offering both the yin and the yang energy, having both that level of support, and just having two people. Let's face it, most of these experiences is an arc that can last for several hours. What happens when they need to go to the bathroom? Okay, is there going to be anyone really watching and taking notes and addressing any needs that you might have? I'm not saying that's essential, but something to think about, right? Okay, the most important thing is, do you trust this person? What's your gut tell you? Or these people? Is this person or are these people going to be able to be there for you in a non-judgmental way to help support you through the entire process? What's your sense about this person? Listen to that inner voice and make that decision carefully. These experiences, these medicines can be profoundly impactful in the right setting with proper preparation and integration with someone who knows what they're doing and can support you all the way. So if you like this video, give us a thumbs up. And if you want to make sure you get future videos like this, subscribe, hit the notification bell. We typically upload 2 videos a week. And of course, we love your comments. Any feedback you have, questions, we welcome them and we do respond to them. So thanks very much for watching.